Hi there, I'm Sharon Gilmartin, Executive Director of the Safe States Alliance, and I want to welcome you to this episode of our Navigating Your Career Amidst Uncertainty series. Whether you're a student preparing to enter the workforce or an early career professional trying to figure out your footing in public health, I want to acknowledge that you're stepping into the field at a time of enormous change and enormous potential. It's a challenging moment, but one that also has opportunity. So hopefully today we can make a little bit of sense of that. Let's start with what's shifting right now in 2025. We're seeing pretty big structural and funding changes across public health systems, especially when it comes to injury and violence prevention. The uncertainty around federal funding is driving a lot of this. Historically, state and local health departments have relied heavily on federal funds from agencies across the Department of Health and Human Services to support their staff time and overall prevention efforts. Right now, what we're seeing are significant changes at the federal level. There have already been more than one large reductions in force across many of our key federal agency partners, and there continue to be challenges with getting FY25 funds out the door to states and local partners. As you can imagine, this has already disrupted staffing and program planning and service delivery across states and localities, and it has the potential to cause even more down the line. Programs are already doing more with less, or they're waiting on critical funding decisions. And this affects travel, hiring, training, yes, even internships and entry-level opportunities. Two other big decisions are in the mix right now. One of those is the appropriations process for FY26 funding, and the other is restructuring at the federal level. You may have seen that the administration has proposed standing up a new federal agency to house any non-infectious disease prevention efforts. This would be called the Administration for a Healthy America, or AHA. When the president submitted his budget to Congress in May, it didn't include funding for traditional injury and violence prevention lines through the agencies we usually look to fund our work. Agencies like CDC, Centers for Disease Control and Prevention, HRSA, the Health Resources and Services Administration, or SAMHSA, the Substance Abuse and Mental Health Services Administration, and NIH, National Institutes of Health. So instead, there was a consolidated version of this budget under the proposed new agency that pulls from all of those other different agencies. That said, Congress has to authorize the creation of a new agency separate from the appropriations process. This means that there are still a lot of opportunities for things to change as Congress moves through both the appropriations discussions and the authorization of a new agency. So, in addition to navigating your career, this is also a time to consider using your voice as an IVP professional and as a private citizen. We all have the chance to let them know just how vital this work is and how their communities benefit when we have strong federal investments in prevention. Okay, so back to the changes. I've laid out a lot of past and potential shifts in the field. Let me also highlight some positive things as well. We are definitely seeing the field of IVP evolving. We're seeing stronger integration of community-based solutions. We're seeing more and more cross-sector collaboration, especially with mental health, behavioral health, law enforcement, education, housing, and other upstream partners that we know can be such powerful drivers of health. We continue to see issues like firearm injury, overdose, suicide prevention, adverse childhood experiences, drawing broad attention, and more sustained and coordinated efforts for prevention, which also means that we're seeing the settings in which injury and violence prevention practiced growing. So I mentioned a whole bunch of partners already. I'll also highlight that IVP programs in hospitals and healthcare organizations have become a tremendous asset in our prevention ecosystem. So all of this to say that while the federal environment is uncertain, the demand for your skills, your ideas, and your energy has never been more important, and there are so many opportunities to plug them into the field. If you're just starting out, I know this can all feel daunting. You're probably wondering, how do I build a career in a field where funding's unpredictable? How do I gain experience if organizations are pausing hiring or limiting travel? First off, let me tell you, you're not alone. Many professionals in this field have navigated similar uncertainty or are also navigating uncertainty, and they've gone on to build deeply meaningful and impactful careers. So the key here is staying flexible, staying connected, and open to different ways of contributing. One of the things that comes to mind for me is looking for opportunities to gain hands-on experience. And that can be through part-time roles or fellowships, virtual work, research assistantships, project-based work. The goal here is to get to know the organizations doing work that you care about, and most importantly, build your network. Relationships really matter in this field. They open doors, they offer mentorship, and they keep you grounded when things feel unpredictable. The other thing I'll say here is that something doesn't have to be named injury and violence prevention work for it to be injury and violence prevention. So supporting the development of physical infrastructure in your community is IVP work. Job training for youth is IVP work. Strengthening support systems for older adults, IVP work. Expanding your definition of IVP work both builds your resume and your understanding of how prevention efforts build protective capacity, which makes you that much more marketable in this field. Finally, I can't emphasize this enough. Your professional associations are here to help. At Safe States, we're working really hard to support you through this moment. We're adapting our programming to make professional development and networking more accessible, offering virtual events, webinars, mentoring opportunities, all so that you can grow your skills and connect with leaders in the field no matter where you are. Please, please, please take advantage of these things. We're also advocating fiercely for continued and expanded funding for the CDC Injury Center and so many of those other federal agencies I mentioned earlier, but really for stronger support of the IVP workforce. And that's including pathways for student and early career professionals. We're also creating more spaces specifically for you to learn, to lead, and to lift each other up. Our early career work group, learning communities, and leadership development resources are just a few of the ways we're investing in the next generation of injury and violence prevention leaders. So my ask of you is to hang in there and to keep going, because you belong in this field and we really need you. Public health and IVP is a calling, and it's also a community. Safe States is here to make sure you never have to navigate it alone. Thanks for spending a little bit of your time with me today. I hope to personally connect with you soon. And I just want you to know my virtual door is always open. Take advantage of Safe States, of our network. We are so glad to have you in the field.